Hi everyone, my name is Alicia Roth and I'm going to be talking to you guys about Parkinson's disease in the geriatric population. Parkinson's disease is a progressive neurodegenerative disease that affects between 100 and 200 per 100,000 people over the age of 40 and over 1 million people in the United States alone. There's an increased incidence of diagnosis over the age of 60 as well as a mean diagnosis of the age of 70.5 years, which shows that this primarily does affect the geriatric population. There are 3 cardinal manifestations of this disease, including tremors, bradykinesia, and rigidity. There are certain risk factors for the disease, including being older, as I've mentioned, being a male, having a family member who has this disease, as well as being continually exposed to certain toxins such as herbicides or pesticides. So you can really see there's no modifiable risk factors except for being exposed to certain toxins on a routine basis. There is no diagnostic that will confirm this disease. It's all just based on your history as well as your physical examination. So you need to make sure that you do a really great job at assessing your patient. One of the questions that we would want to ask is whether or not they take, not whether or not they take any medications, but what medications they do take at home, because certain medications, such as antipsychotics, can mimic Parkinson's disease. So you want to make sure they're not taking any of those medications. Next, you would want to ask about tremors. Ask whether or not they've noticed a unilateral tremor that's worse at rest and better with movement. This is often the first thing that brings the patient into the office, is this noticed tremor. So you would want to ask whether or not they've had that. Finally, we would want to assess for bradykinesia. So we would want to ask whether or not they've noticed any uncoordination or difficulty doing small movements such as buttoning their shirt or tying their shoelaces. And this would just, like I said, demonstrate bradykinesia. And we would suspect that our patient would not be taking any medications that would mimic Parkinson's, that they would have a tremor, and that they may or may not be having difficulties with these small movements, suggesting bradykinesia. Next, we would want to move on to our physical exam. We would want to first assess for tremors. So as I mentioned, the tremor is going to be worse at rest. So you want to kind of have your patient relaxed and just have them with their hands sitting on their lap, and you'll begin to notice a tremor. The tremor, like I said, is unilateral. It's often called a pill rolling tremor. So you're going to notice it with their thumb and their forefinger, and it's literally just kind of a tremor, a pill rolling tremor. Next, you would want to move on to assess for bradykinesia, so you can have them do small repetitive movements such as pronation and supination. You would want to measure the speed and amplitude of those. You'll notice in a patient with Parkinson's disease that the amplitude of that will begin to slow down with the repetitive movement. Finally, you would move on to rigidity, and how you would assess for this is having the patient perform passive movements. You'll begin to notice what's called cogwheel rigidity, which is just patterns of relaxation and rigidity. This rigidity is often unilateral, usually the same side as the tremor. So in our instance, we'll just say the right side. So you'll notice that as well. And we would suspect that our patient with Parkinson's would have 2 out of 3 of those symptoms, which would confirm the diagnosis of Parkinson's. As far as the management of this disease, there is no real treatment, but the management is used with levodopa. It's been proven to be the most effective at treating the symptoms of the disease, or managing the symptoms, So you're going to start with the smallest dose, which is usually combined with carbidopa to just kind of subside some of the side effects. So start with the lowest dose of the medication and just titrate up based on how your patient is tolerating and responding to the medication. As far as the management at home, you need to educate your patient that this is a lifelong disease process. They will have to take this medication as prescribed for the rest of their life, and it's very important to do so. Next, you want to encourage exercise. Maybe not right when they're diagnosed, but later on in life, balance is going to become a problem, which is going to put them at risk for falls. So you want to encourage exercise because that can actually assist with their balance later on. So encourage things such as walking or stretching, anything that will help with their balance. And then finally, we want to encourage safety. As I mentioned, these patients are going to be at an increased risk for falls, so it's very important to encourage fall prevention. So removing rugs that are not needed, removing cords, no extension cords in the house at all, installing grab bars, anything that can put your patient at a greater risk or at a greater chance of not falling is most beneficial to your patient. So I hope you guys learned a little bit about Parkinson's. I actually learned a lot while doing this research. So I hope that you learned a lot, and thank you guys for your time.